the CMS website and some helpful tips for finding information on the CMS or the Medicare website. All right, let's take a look at what we're going to cover for today's session. We're going to look at some of the most frequent places that coders and those in the coding and billing industry tend to go to on the Medicare or the CMS website. Some of the most common things that I get questions about are, well, where do I find this information? Where do I find information from Medicare on this or that or the other? We're going to look at their internet-only manuals. We're going to look at the Medicare coverage database, the physician fee schedule lookup, some of their web-based training modules, and then we're going to wrap up with forms, evaluation and management guidelines, and some of the guidance documents that they provide. Now, when we're looking at the CMS website, if you haven't been to the CMS website, this is the national website, so this is not carrier specific. If you're looking for carrier specific, you're going to need to go to your region's Medicare Administrative Contractor or MAC. Places like Novitas, WPS, NGS, those are the sites that you need for your specific jurisdiction. But there's information on the national CMS website that is good and covers everything across the country. Remember that your local coverage documentation can be stricter than national, but it can't be any less restrictive. So it can't have any broader guidelines. So these are kind of your baseline. This tells you where to get started. And then when you go to your specific carriers, that gives you, well, what's specific for this state or for this region. So when we look at the CMS website, it's www.cms.gov. It's this link right up here at the very top of my slides. The information that you can find on this website, there is so much information. And yeah, I'm going to show you the website. I'm going to navigate through some of the stuff on the website with you. But as sure as you get comfortable with this website, they will change it. It seems like every 6 to 8 months, they do some update to the look of their website. You'll still be able to find the information. Most of the links will still work, but they'll move things around to make you actually go in and look at the website again and figure out where are things, because they move them around a little bit. When you're asking about coverage information for Medicare, there are 3 predominant places on the Medicare website that you can go to for issues regarding coverage. You can look in what we call the internet-only manuals. You may hear these pretty commonly referred to as the IOMs, or they'll say publication 100-04 or 100-02. We'll take a look at those and I'll show you what all of those different numbers and what the different publications are. Then you also have the coverage database that lets you look not only at the national policies, but at those policies by your local Medicare Administrative Contractor or your local MAC relating to specific services that your providers may be providing. And then we've got the physician fee schedule lookup. And that's where you can look up a lot of information about what the physician's actually going to get paid or which Medicare modifiers are allowed. And how those modifiers may impact payment, what payment is in different places, right? We get paid a little differently in the facility than we do in a physician's office. So all of those are places that we're going to look at. So let's go ahead and start out by talking about these different Medicare coverage resources that you have available to you. I'm going to go over to the CMS website. So I just went to that first link, right? The www.cms.gov. This is their website as of today. And when you look at this website, there's a lot of information. Everybody's like, it's a little overwhelming. I'm not sure where to start. Do I click on this Medicare thing? If I want information on Medicaid, do I click on Medicaid? We're not going to talk about Medicaid today. We're going to focus on Medicare services and the things that are specific from a national perspective. What I'm going to encourage you to do is scroll down toward the bottom of this page and look over on the left-hand side. There is a yellow box and it says top 5 resources. And these really are the top 5 resources. These are the resources that are utilized most frequently on the CMS website. The top 3 things we said we were going to talk about were the internet-only manuals, the coverage database, and the physician fee schedule lookup. Well, 2 of those 3 things are available right here in your top 5 resources. If you click on manuals, we'll click on manuals, and you'll see over here on the left-hand menu, then you have that internet-only manuals. The internet-only manuals are the manuals as of today. There are still paper-based manuals available out here. Those are old. Those are actually from before 2003. You'll notice on this screen right here, it says in 2003, we transformed the CMS manuals into web user-friendly presentations. And these are these online-only manuals. So if we click on the internet-only manuals, then you get a little box that pops up all the different manuals. There are not 9. If you'll notice, there are a total of 26. So you will have to scroll through the pages. But each of these provide different information. The two that I would say I use personally most frequently are the benefit policy manual, where that kind of outlines the benefits that are available to a Medicare beneficiary, and the claims processing manual, which is known as publication 100-04. Claims processing manual actually answers a lot of your questions about how to report certain services on the professional or provider side of the billing process. But there are manuals for all sorts of things. There's a state operations manual that actually outlines some of the policies and procedures that a facility must have in place in order to be covered and be considered a Medicare approved facility. If we click on to the next page, you'll find that we actually have one all about Medicare managed care, the 100-16. Those are all of your Medicare Advantage plans, right? Your Medicare managed care plans. So your Part C contractors, there's a lot of information in there all about risk adjustment and those types of things. You'll see that there's a Medicare manual all about ESRD, or end-stage renal disease, because they get billed completely differently. They're kind of a total entity in and of themselves. But as you click through here, you'll see that there's a manual for just about everything. All of these manuals are PDF files. So if we go back to the first one, I'm going to open the one that I use most frequently. That would be the claims processing manual. So if I just click on this blue hyperlink that says 100-04, I can then pop out just the chapter that I want to look at. Well, the one that I use most frequently, because most of the time I'm working on the provider side of things, not the facility. I'm working for a physician or a physician group. Chapter 12 of this Medicare Claims Processing Manual is all about physicians and non-physician practitioners. So if I click on Chapter 12, then I'm going to get that PDF document. And as I scroll through the PDF document, some areas of it, there are additional hyperlinks. If you click on that transmittal, that takes you to any Medicare transmittal that came out relative to this particular document since this was revised or published. You'll notice this hasn't been revised since November of last year. There haven't been any changes that it needed to address. But as you scroll through here, you can search and see what you're looking for. You'll notice that Section 20 is all about the Medicare physician fee schedule. Talks about assistance at surgery, supplies, when the fee schedule is updated, all of that information. Section 30 is all about correct coding, what you can and cannot bill together, what the rules are. There's a whole section on evaluation and management services here, especially that initial preventive physical exam and annual wellness visit, or the IPPE and AWV. As you scroll down even further, you're going to find that there are specifics, coding policies for all sorts of things. And when you get down into Section 40, there's specific services or specific guidelines for surgeons and global surgery. There's specific information for anesthesia, path and lab, radiology, and so on and so on and so on. So you'll see this is where you can find so much information. The nice thing is a lot of these are links. So if I click on 40, it actually takes me down to where Section 40 starts in that document. So that table of contents isn't just I got to scroll down until I get to this, but you can click on those and they're interactive links that will take you further down in the document. For example, I clicked on 40 and it took me right down to surgeons and global surgery. And it defines what a global surgical package is, what components are included, all of that information. This is a treasure trove of all the CMS guidance, right? This is where we can find a ton of information. So we've got our internet only manuals. I'm going to go back a few slides here. A few pages on the website. The other thing that I would say in this top 5 resources, right? We said our top 3 we were going to look at, the internet only manuals. Took a brief look at those and saw there's a ton of information there. If you need some good nighttime reading, that's great. I always joke that'll put you right to sleep. Just kind of depends on what kind of mood you're in. If you're like me, it doesn't put me to sleep. It makes me go, oh, well, they said this here. I want to go read. I think they said something about it over there. And my mind's constantly pinging between the documents to go, okay, and build a bigger picture of what's really going on from a Medicare perspective, put it all together. The other link of our top three, right, we said internet-only manuals, the coverage database, and the physician fee schedule lookup. The coverage database is also listed here in the top 5 resources. It's that second link. It says Medicare coverage database. If we click on that Medicare coverage database, this allows you to look for local coverage determinations, national coverage determinations, and additional supplemental coverage articles, not only put out by CMS for a national level, but also those local ones put together by the different Medicare administrative contractors, like your NGS, your WPS, your Novitas, your Palmettos, all of those different groups. So when you come in and look in this area, you can search by document ID if you know what it's called. I don't know very many people that search by document ID. Most people tend to come in and look for document type. And under document type, you can narrow down what you're looking for. You can look for both your national and your local documents at the same time. You can look for just national coverage determinations or just local coverage determinations. Now, a lot of people ask me, okay, what's the difference between national coverage documents and local coverage documents? Usually, the national coverage documents are telling you whether or not Medicare covers a specific service. Just flat out, do they pay for it? Do they cover it at all? The local coverage determinations then set forth what that Medicare administrative contractor requires be done or documented for that covered service to be a paid covered service. At least that's my experience and what I normally see there. So the national determination is more, do we cover it or not? And the local coverage determinations are more around payment. If we're going to cover it, here's what you have to do for us to actually pay for it as a covered service. So I'm going to leave it on national and local coverage documents. Select the geographic area or region. You'll notice there's an asterisk there, so you have to do that. It's a required field. Let's just say all states, okay? And then down under what I'm looking for, I can either put in a keyword or I can put in a CPT code, CPT or HCPCS code, whatever it is that I'm looking for. I'm going to start with keyword, and I'm going to do a search for, let's say, I'm thinking of the behavioral health assessments and interventions. So I'm going to put in intervention. And then I can click search by type. And it'll run a search for me and see if there are any documents that meet my criteria. And it gives me a little summary. It says, you were looking at all these different types of, you said I wanted to look at everything, right? National and local. I'm looking for the keyword intervention, and I'm looking in all states. Well, as I scroll down, I find out that there is a national coverage determination around screening and behavioral counseling interventions in primary care to reduce alcohol misuse. So there I've got a national coverage determination. It says when they pay for it. The next is an analysis, and that shows what analysis Medicare did in determining whether or not they were going to cover it as a national coverage determination. Then again, there are more coding analysis for labs, additional labs that they did. Technological assessments, again, there's a whole list of these. And then as we get down, we have Medicare coverage documentations. Now you're going to notice for the Medicare coverage documentation, there's a couple of things. There are articles, and then there are local coverage determinations. The local coverage determinations, or the LCDs, are those, here's what we have to have, right? These articles used to be called supplemental articles, right? And they provide additional information for that particular Medicare administrative contractor, right? It's a supplemental instruction article. Here are the additional things that we require that you do to get these services paid. Now, you're probably going, okay, well, how do I get that article? Like, I see the article ID and I see what it's titled. All you have to do is click on the article ID number, and it's going to open that particular document. You're always going to see your CPT license agreement, right? Because these are all including CPT codes. So we have to acknowledge that, yes, we understand that CPT is owned by CMS, or I'm sorry, by AMA. So we click accept. And then it will show you, here are all of the local coverage articles regarding biological products for wound treatment and surgical interventions. which is not what I was looking for, but I wanted to show you the different options here. Now you'll notice these are all put together by National Government Services, so that's the contractor name. But then you find that there are different ones for different contract types. Is it a Part A or a Part B contract? What jurisdiction is it in? You'll notice that some of these, it applies to both Part A, Part B, and home health and hospice, but only for jurisdictions J through K. In this case, that's Connecticut. Here's the one for New York State, entire state, downstate, upstate, Queens. You'll notice there's a different one for each of these. Then you can click on the contractor name if you want more information on National Government Services, or you can continue to scroll down and it'll give you the actual article information. Starts out with general information, the article ID, what it's titled, what the copyright statement is, when it went into effect, and when it was revised last. And then it gives you the actual guidance. And it says, okay, you know, this is a supplemental article all about these biological products for wound treatment and surgical interventions. Interventions is in bold because that was the key word that I searched for in my initial search. Talks about all of the coding information, that it may be subject to NCCI or OPPS. And again, we scroll on down here for claims submitted to a Part B. All services or procedures performed on the same day for the same beneficiary by the same physician need to be billed on the same claim. If you're talking about Part A, they talk about, is it an inpatient or is it an outpatient claim? And again, they give you more direction. As you scroll down further, they'll give you more information on codes, if there are any applicable to this. In this case, it's a wide variety of things, so they don't list all of those different code options. And then they give you the revision history and any associated documents that you may want to review. In this case, it sends you to your local coverage determination. Your supplemental articles are just that, they're supplemental. The local coverage determination is actually going to be more informative and give you more information. So we're going to scroll down a little bit farther and let's see, okay, First Coast has an LCD around health and behavior assessments and intervention. That's what we were looking for. So we're going to click on that L33834, which is the health and behavior assessment. And that's going to pull up our local coverage determination. And again, it's going to show us, here's all the information, the general information, the document ID, all of that, when it went into effect, that it is a local coverage determination related to a related national coverage determination. Here are the coverage and limitations, so when they're going to cover it and when they're not. Indications kind of give you what needs to be in the medical record, what needs to be supported by the services that they're looking at in the documentation if you're billing for these. And it gives you a whole list of all of the things that need to be included. And then they go into limitations. There are certain limitations. If you can't do this or you can't do that, and that information is missing, you need to indicate why we don't have that information, or services that may not be covered as a Medicare benefit. Then again, they come down and give you more bill types, right? There isn't a revenue code that's applicable. There's also not a bill type code that's applicable, but there are specific CPT codes that they're talking about. And they're looking at these 5. Anytime you bill these 5, all of those rules above apply. They fall into place. So this is great information, especially when you're trying to figure out what needs to be in the documentation, or if you're working on building educational plans for physicians. You can come out here and look and see, well, does Medicare tell me what should be there? Because Medicare is generally a pretty good baseline. Most of the commercial carriers kind of let Medicare set the pace, and they usually follow in some format. Now, some of them go on and give you their specific rules, but for those that don't, sometimes Medicare is the best that you have as far as a comparison or a guidance resource. So that's how you find how you use the coverage determination database. So we've been through the internet-only manuals, we've been through the coverage database. The other of the top 3 where you're looking for coverage information that I find useful is the physician fee schedule. Now, unfortunately, they don't have a link off of the main page for physician fee schedule. It's just not listed down here in the top 5 resources. And some people find it a little difficult to find, but it's really not bad. If you're on the CMS website and you go up to the well, as I'm looking at it, it's the upper right-hand corner, there's a search bar. And I can type in there. I can type physician, and you'll see it already starts to fill in for you. And I'm actually, I'm looking for 2016, but I'm going to go to the Lookup tool. So I'm going to go to the physician fee schedule Lookup. And the reason that I do that is I may want information about 2016, but when I get in there, it actually allows me to look at more than 2016 if I decide, oh, yeah, I want that, but I wonder what it was last year. It gives me a little bit more flexibility. So to start my search, I click on the Medicare Physician Fee Schedule tool, and it says, again, you've got to start search. You've got to click down here where the, oh, it threw me into a different screen. Let me make that a little bit bigger so everybody can see it. About midway down the page, there's a picture of a little laptop. It says, click here to begin your physician fee schedule lookup. If you click on that start search button, again, you're going to have to accept the CPT license. Say, yep, I understand that. Okay. And this actually gives you the physician fee schedule search tool. This allows you to do a couple of things. This allows me to look at pricing information, payment policy. It allows me to pull in modifiers and indicate how they are used for different codes and when they're covered and when they're allowed and when they're not allowed. Look at RVUs. If you've got physicians who are being paid based on those relative value units, right? RVUs is how we assign weight to a certain CPT code, and that affects the dollar value for that CPT code. Your geographic price cost index. So if you want to look at cost price for different geographic locations and you want to see how it compares from one to another, you can do that. Excuse me, you can look at all of that information or just a piece of it. I'm actually, the most common thing that I get a request for is, well, how do I find out if Medicare allows me to use a specific modifier on a specific CPT code? Well, in order to do that, you come here to the Physician Fee Schedule database. You click on the second button here. I want payment policy indicators, right? I'm looking for modifier information. And you'll notice when I clicked on that, it changed my little box down here to say, well, what modifier are you looking for? And we'll get to that in just a second. Then I can either look for a specific HCPCS code, or I can look for a list of codes or a range of HCPCS codes. Now, this throws some people off because we say HCPCS, right? Healthcare Common Procedure Coding System. The important thing to remember is that CPT is a part of HCPCS. I know we always think of HCPCS as that, well, I shouldn't say always. Several of us think of HCPCS as that little coding book, right? That extra one that covers drugs and biologicals and some of the Medicare only codes and all of that. But that book is actually entitled HCPCS Level 2. And that's because CPT are HCPCS Level 1 codes. So when it says HCPCS, in this regard, it means CPT or HCPCS codes. You can use either of them in your searches. And we want values for a specific HCPCS code in this case. So let's see, let's do 80101. Okay, it's a lab. It's actually a drug test. And modifiers. Which modifiers do I want to see? Well, I want to actually see all modifiers. So I have the option to either say, you know, do I want a global or physician professional service or technical service? Does that concept apply? Then I can either say a 26, a TC, a 53, or all. Well, I want all because the one I'm looking for may not be in this list, right? I may want to see if I can put a 59 on it, or I may, right, separate procedure. Or I may want to see, can I have 2 surgeons for a certain procedure? What can I do? So I'm going to click on all modifiers, and then I hit submit. And you'll see this says, okay, payment policy indicators. For a single HCPCS code, there were no records found for this particular CPT code. All right, well, let's go in here and change this to a different CPT code. Forgive me, I got to pull down my CPT book, and we're just going to pick a random procedure. We're going to pick a valvulectomy of the tricuspid valve with cardiopulmonary bypass. So I'm going to put in a 33460, and I'm going to update. Okay, and as I scroll down here, now you'll see I have some values. Okay, it says that here's the procedure that I looked up. It's a revision of a tricuspid valve. Procedure status is an A. That tells me who pays for it. Okay, and I'll tell you how you find the document that helps you determine what all of these are in just a second. PTCT, that's your professional component, technical component. Does that apply? What is the global days for this? This particular has a 90-day global period, right? So this is great for figuring out what your global periods are for Medicare. Multiple surgery has a status indicator of 2. Bilateral surgery has a status indicator of 0. I will tell you 0 means nope, you can't do it, right? Just like it does for NCCI edits. And that would be because you only have one tricuspid valve. You wouldn't be able to bill that bilaterally because you don't have one on each side. Assistant surgery has a 2. Co-surgery has a 1. Team surgery, no, you can't do this as a team surgical approach. Physician supervision and diagnostic imaging have additional numbers. So how do we figure out what all of these different things mean? Well, guess what? There's this nifty little download that says help with the physician fee schedule search. And if you click on that, this document's actually going to help you through how to use the search, right? How to use the searchable medical. They've got guide documents out there for all sorts of things. How do I do this? Ask, put it in the search bar. Okay, as we scroll down, this is going to take you through how to actually use it. And if I remember correctly, if you go all the way down to the bottom, this is where it starts giving you some of the status indicators, right? It's an A is an active code and it's covered, and who covers it for the different things. And then global surgery, right? Shows you here's what those days are. They give you all of the definitions right here. So for PTCT, okay, when we looked at that one, if it had a 0, it was a physician service code, and technical and professional components didn't apply. So we don't have to worry about splitting it with a 26 and a TC. As we scroll down, a couple of things that I remember that it said, where's that? So as we keep scrolling down here and we get to assistant surgeons, assistant surgery, right? It had a 2. That meant that there was a payment restriction for assistance at surgery that does not apply to this procedure. We will pay for assistance at surgery. So they say, okay, that's one that we recognize. You may need an assistant at surgery for that particular procedure. Okay, there's a ton of information on the fee schedule lookup. Okay, so far we've talked about where to find information on what's covered for Medicare, right? We talked about the internet-only manuals, we talked about the coverage database, we talked about the physician fee schedule. Now we're going to look about what other information can we find on the CMS website. What's really useful for those that are new coders, that are new to the industry. Maybe those are just new to Medicare billing. Maybe you've only ever worked in pediatrics and your background doesn't include Medicare patients. What information is helpful here? And that's where we're going to get into looking at the forms that are available, right? When I think forms, I think immediately the Advanced Beneficiary Notice, or that ABN. We're going to talk a little bit about the Evaluation and Management Guidelines. You can find those on the CMS website. We're going to talk a little bit about what kind of web-based training modules they offer. Those web-based training modules are all free, and the bonus, you get CEUs for some of those. And then we'll talk about the guidance documents, all of the other resources that Medicare provides, and how do we find and where do we search and what information is available to us. Back over to the web, I'm going to go back to the main CMS page, and I'm going to scroll down because under my top 5 resources, CMS Forms is another one of the top 5 things accessed by people regularly on the CMS website. As you'll look here, you'll notice that there are a couple of different things. There are those ABNs, Advanced Beneficiary Notices. This one is for a skilled nursing facility. There are different ones for different environments. There are also notices of non-coverage where Medicare says we're not going to pay for this. There are inpatient and facility assessment instruments. So anytime that you have a national coverage determination or a local coverage determination and they require your provider fill out a specific form, chances are you're going to be able to find it here in this forms repository. Again, there's 199 entries in here. So you can filter by what you're looking for. So we could filter this and say, I want it to only include the word advanced, because that'll give me, here's the one for skilled nursing, here's the one for home health, and here's just the general advanced beneficiary notice. If you click on the link again for the form, it will take you right over to a link and you can click on it and say, oh, here's my fee for service. That's what that FFS stands for, Advanced Beneficiary Notice. And when you click on that, again, it's going to take you not just to the form, because the form is down here, but it's also going to give you instructions for correctly filling out the form. And it'll tell you, hey, look, there's even more information in that Medicare Claims Processing Manual, Chapter 30, Section 50. So their website, while sometimes cumbersome and hard to get used to, especially if you've not ever been on the CMS website before, really is interlinked, and their searches work really well if you just use those search forms. Okay. In addition to the forms, another area that I find myself coming out to the Medicare website for is evaluation and management, right? Evaluation and management services are a large part of just about every practice. Now, I say that with the exception of anesthesia, because anesthesiologists don't do a lot of evaluation and management most of the time, unless they're a pain management doc. But most everybody else includes some element of evaluation and management, right? Some portion of their practice, that's what it is. Well, if you come out here to Medicare, again, put in the evaluation and management, right? Put it in the search bar. It immediately pops up. Oh, do you want the E&M guidelines? Is that what you're looking for? So if you click on that, it takes you, here are the guidelines. But the nice thing about this is it gives you not only the 95 and the 97 documentation guidelines, right, that we use for pretty much every payer, but it gives you this nice evaluation and management services guide that includes the 95 and 97 guidelines and tells you how Medicare views certain things. Now, they don't clear up everything, right? They don't clear up some of those gray areas in evaluation and management that we will always have, like what's the difference between a detailed exam and an expanded problem-focused exam in the 1995 system, and how many of this do you have to have? Those are generally determined by your specific Medicare administrative contractors. That's not something that the national CMS is going to cover. So that's something that you're not going to find in the services guide. But as you're learning E&M, this is a great document to review. It's going to give you a lot of guidance. It's going to give you reference information at the end of it that says, oh, go here and look, or go try and find this information. We have a Medicare learning module on that, or we have additional information on this. There's lots of different places on the Medicare website that you can find this information. The last two things I want to talk about on the CMS website. Okay, so not only can you come in here and search for everything from advanced beneficiary notices to evaluation and management guidelines, but did you know that Medicare actually gives free education for a lot of their common question areas? Again, I'm back at the main page on the CMS website. If I scroll down to the very bottom and go to, it sounds kind of funny, but MLN products. Anytime you see MLN on a Medicare website, it stands for Medicare Learning Network. That's what it's all about. So if we go to the Medicare Learning Network, see, hey, I wasn't lying. Medicare Learning Network, over on the left-hand side, you've got an option for web-based training. If you click on that web-based training modules, the screen doesn't change a whole lot, but what's in there does. And as you scroll down to the bottom, you can actually go directly to web-based training courses. I'm going to go to the web-based training courses. I already have a login. Because what it does is it takes you, and all of these links are on the slide deck that's provided, okay? So this learner at lms.com, this is the Medicare Learning Network. And what you do is you create an account. If you don't have one, you simply click on create an account. Ask you for like your name, your email address, your physical location, who you work for, and what organization you may be associated with. The American Academy of Professional Coders, or the AAPC, is an option. So you can say, hey, I'm an AAPC member. That's why I'm looking at this information. When you log in, okay, once you create an account, you will get login information. You'll get a login and a password. You actually set those up yourself. So we go ahead and we log into the system. They've changed this a little bit in the past years if you haven't been in there in a while. But what's really nice about this is you can browse by category, right? And the thing I like is look under coding. There are 17 different options for just coding information. If I click on that coding information, it kind of gives me a catalog of courses. Here's the best part about this. I know this is all about CMS and not about CEUs, because we talked about CEUs the other day, but look at the bottom of this. There are CEUs available for, right here, professional associations, right? The AAPC is a professional association. So you can log in and get CEUs for the AAPC. They will actually give you information, like if we click on this link, it says please click here for CE credit assignments. And it says, ooh, made it small again, let me make it bigger. Okay, for the AAPC, they have approval as of July 2009. Any web-based training program that, and these are all based on what Medicare determines them to be, not how long it takes you to go through them. Okay, if it's less than 30 minutes, you get a half a CEU. There's your index number. Anything greater than 60 minutes or 30 to 60 minutes is 1 CEU. Here's the number. 60 to 90 minutes, a CEU and a half, so forth and so on. Well, you do have to print the certificate. You do have to get a 70 or higher on your post-test. And here are all of the different ones that are approved, right? Look at all these. There's one for diagnosis coding using I-10, diagnosis coding using I-9, one about how to fill out the CMS 1500. There's one in here somewhere about how to fill out the UB04. Yep, it's down here, uniform billing. The world of Medicare, that's kind of a general all about Medicare. And it tells you after each of them how many minutes it is and how many CEUs they're approved for. So if you're in a pinch for CEUs, this is a great place to come look and see. Because again, this is all free education. From the training catalog, you simply look for what you want to take. So if you know that other course is there, you can put in here and say, oh, well, I want the one that was on the UB04. So put in UB04 and hit search. Oh, I bet it wants uniform billing. Let's just put in uniform, see what it says. Oh, start a new search. Okay, and it says, okay, here are your two different options. Neither one of those were the one I was looking for. So let's go back to training home. And let's look at coding information. And see all content for this category. And it puts it in a nice little searchable. Here's where I can say, oh, well, they got one about ICD-10, they got one about ICD-10 and PCS. There's all sorts of stuff here, all of these different things that I can look at. And I could narrow it if I just want the ones that are provided by CMS. I can click the little checkbox and says, oh, here are the ones that we were looking at, right? There's the 1500. There's your diagnosis coding using I-9, diagnosis coding using I-10. There's lots of different options. So you can narrow it down. You listen to it. Again, it's completely free. At the very end of it, they'll have you take kind of a what did you learn test to make sure that you were actually paying attention and not just sitting there letting it go. And you have to score 70% or above, and it'll say, hey, great, you did this. It'll log it in their system, and it'll give you a little printout that you can print. And you can enter that information in your CEU tracker, and you got some free CEUs from Medicare. So that's a great way to get some CEUs if you're looking for them. So in addition to let's go back to where we were. I think the last thing that we have to cover is I showed you where to get forms, where to get E&M guidelines. I actually jumped a little bit ahead and went through the web-based training modules. The last thing that I want to show you is that there are a lot of service guides or guidance documents that Medicare puts together for you. Now, I gave you a link here to the preventive services one because that's the one that I tend to get the most questions on from coders that I meet in the industry is, well, where do I find more information? You know, they cover the IPPE or the initial preventive physical exam or the annual wellness visit, that AWV, but they also cover a AAA screening, right? Your abdominal aortic aneurysms, they cover a screening for that. Where do I find information on that? Well, I'm going to tell you the same thing I've been telling you. Come out here to the CMS website and use your search bar. Put in guidance, right? Well, if I could spell GUIDANCE, documents, or yeah, I think it's just, let's just put in guidance, see what comes up. Okay. Guidance on eligibility and redeterminations, right? Those are your appeals. That's a great thing. They give you a whole bunch of information on appeals. There's information on regulations. There's clarifying questions. And if we specify it even further, so let's say I want to know specifically about anesthesia. I want to say, what kind of information do you have for anesthesia? So put in an anesthesia guide, and it says, oh, hey, there's this whole anesthesiology center on Medicare. And if I click on that, look at all the different information it pulls up just about anesthesia. It says, oh, well, here's some important links from a billing perspective. Here are the CMS manuals and transmittals. Here are the issues that we've run into, educational resources. Again, all of this information, it's all about coming out and searching. It also gives you helpful links to related associations, related societies, other places that may have the information that you're looking for. So now that we've gone through all of this, let's kind of wrap up what we've covered. We looked at the CMS website, right? And the most common question that we get about where do we find all of this coverage information on the CMS website? We looked at the internet-only manuals, the Medicare coverage database. We looked at the physician fee schedule and the Lookup tool that's available on CMS for that. We covered the free web-based training modules that they have. And then we looked at the forms, we looked at the service guidance documents, and all of the evaluation and management resources available on the CMS website. There is a ton of information on the CMS website. The best thing that I can tell you is get familiar with that website because, as I said, usually it seems like once a year, sometimes twice a year, they tend to update the look of the website. They don't change the information that's there. They just move around where things are so that you actually have to stop for a minute and look and see, oh, where's that box that I'm always looking for? Use your search tools. The faster that you are, the more acquainted that you become with the CMS website, the faster you're going to be in looking things up and the quicker you're going to find the information that you need. That's always a good thing, right? In the hustle and bustle today, we're all busy. We have tons of things to do. So faster is better if it's accurate, okay? Show that you're a self-starter. The better you become at answering some of your own questions or even helping answer other people's questions, people are going to begin to recognize that. They're going to go, hey, that person knows how to find this. How did you learn that? Where did you find that? Or can you help me out with this? Yeah, it may mean you get more questions, but it also will open opportunities for you for networking, opportunities for moving forth in the industry. So remember that you are your own best resource. And you never want to rely on someone else's information, right? You don't want to be the person that goes out there and says, well, how many CEUs do I have to have for this? And somebody comes back and says, well, you have to have 100, and you take them at their word. You want to say, oh, well, you actually need to have 52, and here's the link where you can go read that for yourself and make sure you're reading it the same way I am. Because maybe when you ask the question, you didn't give all of the information, or there's something else that you know that the person who's trying to help you find the information doesn't know. Or maybe you just may interpret the information differently. So be your own best resource. These Did You Know sessions with us are all about how to get started, where to find some of the common information, where to start your journey of becoming an expert in researching and finding the information that you need so you can continue to grow and develop and learn all of the different things that are going to help you in your job and in your workplace. So hopefully today's Did You Know session all about the CMS website was helpful and you learned something new down the road. If you've got additional questions or additional things that you would like us to entertain for doing in a future Did You Know, please don't hesitate to let us know. We've got a form up on the website, on the CCO.us website. Go out, check that form out and say, hey, here are the things I'd like to see you cover in the future. These are great places for us to know what it is that the industry needs. What areas are you looking for? But hopefully this was helpful and you have a great day. Thanks.